Good afternoon, respected professor and audiences. I am Sarunrat Chusinkul. I would like to present the research on the topic of remineralization effect of diamine fluoride on artificial incipient caries in primary teeth. Dental caries is one of the most common diseases in childhood that can develop as early as the primary teeth begin to erupt and is still the major concern oral health issue in Thailand. According to the Age of Thailand National Oral Health Survey, the percentage of caries lesion in 3 years old children is 52.9, in 5 years old children is 75.6. The percentage of initial caries lesion in 3 years old children is 31.1, and in 5 years old children is 31.3. The initial caries lesion in primary teeth could be observed from the discoloration or enamel, occur in chalky white or brownish color, which could be classified in ICD code 1 and 2. The early detection sign of initial caries lesion is important to prevent the progression of the lesion, preserve tooth structure, and reduce aggressive restorative dental treatment. From the literature review, SDF is effectively used in active cavitated dentine caries lesion. However, the study about the effect of remineralization in initial caries on smooth surface of primary dentition is still unclear. Our study objectives. The first one is to evaluate change in mineral density on artificial incipient caries or primary teeth enamel after applied diamine fluoride, and the second one is to compare remineralization effect between applied diamine fluoride and control group. Sample selection. The inclusion criteria was caries-free primary incisor, which might be extracted or naturally exfoliated, and the exclusion criteria are as shown. Material and method. The sample size was calculated by using G-Power program, and the result was 19 samples. We chose 18 samples and separated into 2 groups in our experimental study. Material and equipment. Material in our study was 38% SDF, or in the commercial name dopamine, and the equipment we used micro-CT to evaluate mineral density. For the method, we start with storing 18 primary incisor in 0.1 thymol solution at room temperature. Then we polish with pumice and keep in normal saline solution until being used. After that, we rinse with deionized water and wipe off with tissue paper. Each specimen will be coated with nail varnish, followed by the top coat, except for the target area 1 square meter windows. Then immerse in 3 ml of demineralizing solution or D1 and incubated in 37 degrees Celsius for 5 days to create artificial incipient caries lesion. Each specimen will be fixed in the utility wax and putty. The 4 reference lines were created on putty surface for fixing the position of the specimen at the center and the target area in perpendicularly. Next, measure the pre-treatment baseline mineral density by using micro-CT and separated the sample into 2 groups. Group A, control group, the sample were immersed in deionized water or distilled water, and Group B, SDF group, the sample were applied 38% SDF and then rinsed with deionized water. Both groups went through 7-day PS cycling process, and then we measured the post-treatment mineral density by using micro-CT. Statistical analysis. The data were assessed for normal distribution by using Kolmogorov-Smirnov test. We used dependent parity test to compare pre and post mineral density within the SDF group due to the data was parametric, and used Wilcoxon-Sarang test within the control group due to the data was non-parametric. To compare mean percentage of remineralization between groups, we used Mann-Whitney test due to the data was non-parametric. And the statistic analysis was performed using SPSS program version 20 with the significant level set at 0.05. Result, the mean depth of artificial caries lesion of enamel was 60 microns. The micro-CT image showed the pre and post-treatment mineral density between two groups. After applied silver diamine fluoride, there was increase in mineral density as seen very opaque in radiolucent area at enamel surface. We observed that the mineral density in SCF group was higher than the control group. The graph were plotted by the mineral density value in every 10 micron. Mineral density post-treatment in SDF group, as seen in the upper line in the green graph, was higher than pre-treatment. The area under the curve was calculated for the percentage of remineralization. The percentage of remineralization in each group indicated the proportion of mineral density gain and the mineral density of the original lesion. Wilcoxon-Saran case was used to compare pre and post mean mineral density within the control group, and the result was not significantly different between pre and post mineral density. The post-treatment mineral density in SDF group was significantly higher than the pre-treatment. Using the dependent parity test and to compare the mean percentage of remineralization, we used Mann-Whitney test, and the result was the mean percentage of remineralization in SDF group was higher than the control group. Discussion. The enamel caries lesion is characterized by four zones. The most superficial surface zone thickness is 10 to 50 micron, and it may extend up to 120 micron. In our study, we chose the depth of the lesion 10 to 60 microns to be the reference for the artificial incipient caries lesion. There are many methods to determine enamel remineralization. The first one is polarizing microscopy. The specimen will be cut into the thin section and then use the different filter with the injection of blue resin for the obvious visualization. This technique is time consuming and not provide the quality of mineral density change in the lesion. Second one, the scanning electron microscopy. This technique is used to evaluate the morphological surface in three-dimensional. The third one is transverse microradiography, or TMR. It is the standard technique to use to evaluate the mineral density change in two-dimensional. It is destructive and time-consuming. The last one is micro-CT. The micro-CT is the gold standard. The advantage of micro-CT are non-destructive, provide three-dimensional structural analysis, and allowing the specimen to be remature after the PS cycling process. So we decided to use the micro-CT. In our study, the percentage of remineralization of SCF group is significantly higher than the control group through all the artificial incipient enamel caries lesion depth of 60 micron. The micro-CT image showed the pre and post mineral density between two groups from the top view at the lesion depth of 30 micron. In enamelation, according to the study of Muhammadi and Farman in 2018 about the effect of fluoride varnish and silver diamine fluoride on enamel demineralization resistance in primary dentition, the result was SCF and fluoride varnish had a similar effect to prevent demineralization. According to the bar graph, the SCF group has the least percentage of surface mineral loss comparing to the other groups. Moreover, the study of Nantani and Hurlich 2015, they compared the percent mean mineral density in artificial enamel caries lesion at proximal area of premolar. After applied silver diamine fluoride and glass ionomer cement, the result was silver diamine fluoride and glass ionomer cement had not significantly different in increased mean mineral density. Our study prove that SDF has the beneficial in remineralize the enamel caries lesion in primary teeth because SDF has the high concentration of fluoride containing 5% fluoride or approximately 44,800 parts per million fluoride. And the another reason is the mechanism of silver diamine fluoride. After apply silver diamine fluoride, silver ion and fluoride ion will attach to enamel surface, initiate the chemical reaction forming calcium fluoride and silver phosphate. Calcium fluoride acts as a fluoride reservoir to form fluoroapatite, and silver phosphate acts as a phosphate reservoir to form calcium fluoride for the formation of fluoroapatite. In addition, silver ion has the role to reduce the bacterial adhesion, and ammonia solution has the role in density, surface tension, and viscosity of SDF. Although our study had proved that SDF had effect to remineralize the enamel initial caries lesion in primary teeth, but it still has some drawback. SDF developed back staining at enamel and dentin cavitated caries lesion from the silver phosphate precipitation, developed mild pulpal irritation and oral soft tissue irritation, which are the clinical limitation of its use. Conclusion: silver diamine fluoride can promote remineralization of artificial initial caries lesion in primary teeth. This study was supported funding by the Research Institute of Ransit University and the conveniently use of micro-CT by the Research Institute of Mahidol University. Would any professor or audiences like to ask any question, or if you have some feedback, we will take it for the improvement. Thank you. ขอบคุณค่ะ
ขอบคุณค่ะ Thank you ค่ะ Is there any question from the floor or any suggestion?
I have a question.
Please.
I want to ask the presenter why did you decided to use the SDF in the initial caries region, because it's not quite common in the practice.
Because commonly we usually use the fluoride varnish for the enamel caries lesion, right? But we interested in silver diamine fluoride because silver diamine fluoride has a high concentration of fluoride and also has the silver ion that had a role in reduce bacterial adhesion or give the antibacterial effect. So we think that if it works for arrest or provide a remineralization process, it will be has more beneficial than the fluoride varnish. Yeah.
Oh, okay. Thank you.
Thank you.
Thank you for the question. And continue from the previous question. So is silver diamine fluoride, is it practical to use in small children?
I think it's very practical because in the case of uncooperative children or patient, we can use the silver diamine fluoride apply at the cavitated dentin caries lesion and maybe in the enamel caries lesion, according to our study that have the result that it work for the enamel caries lesion. Yeah.
Okay, thank you so much.